Well, since this PowerPoint pulls up, we're going to get started. It's not a long chapter today. We'll go ahead and go over the homework also like we did last time. And I want to pass out, I want to give you all your research topics, your research assignments. Your research papers. All right, so we're going to talk about the skeletal system. And again, some of this might be repeat from anatomy, and if it is, great. Repetition is how we learn. So the functions of the skeleton, four main functions in the skeleton. Gives support and shape to the body, protects vital organs, assists in movement, and it manufactures blood cells. The main sites of blood cell formation is the ilium, the vertebrae, and the sternum, and the ribs. And that formation mainly occurs in the flat bones, okay, which would be your ilium, your your ilium is a flat bone. Then calcium and additional minerals are stored, and then they're stored throughout all of the osseous tissue in the skeletal system. Okay, and we're going to go over the difference in the osseous tissue and the different types of tissue. So there's axial, and then there's an appendicular skeleton. The axial skeleton forms the upright part of the body. Okay, it contains 80 bones, and it's the head, the thorax, and the trunk. Okay. The appendicular skeleton is those attached to the axial skeleton. The appendicular skeleton are your appendages. Okay, so just think of the axial skeleton as the axis that everything turns around. Okay, without an axis, the appendicular couldn't exist. There are 206 bones in the body. And then some people may have an additional bone called a sesamoid bone, and we'll talk about that in a minute. The flexor tendons of the great toe and the thumb may contain a sesamoid bone. Okay, but there's 200. Just know that there's 206 bones in the body. So the composition of bone. There's compact and cancellous bone. You look at page 14, that's where that starts. So what compact bone does is it makes up the hard, dense outer layer of all the bones. Okay, so the compact bone is what makes it hard. Okay, the cancellous bone is the porous, spongy bone inside. And that has trabeculae, which means little beams. And it's like a lattice work. Let me see if I've got a picture. I don't think I do. If you look at page 15, there's a picture here of the compact and the cancellous bone. So the cancellous bone mainly exists. It's got marrow in it, and it makes the bone a little bit lighter. But your nerve endings and all your tissue and blood cell formation and all that stuff goes up in through your trabecular bone. Okay. So the structures of a bone include the epiphysis, the diaphysis, and the metaphysis. Okay. So the epiphysis is the area at the end of each long bone. Look at page 16, figure 2.5. And that tends to be wider than the shaft in an adult bone. In an adult bone, the epiphysis is osseous. Okay, it's an osseous type bone. A growing bone will show a distinct line between the epiphyseal plate and the rest of the bone. If you look at, there's not one in here. Okay, page 15 at the very top there's an epiphyseal plate, and there's a line that goes in between the epiphyseal plate and the rest of the bone. That is for a growing bone. That's for a child's bone. That's really how you can tell the difference in a child and a bone that's still growing. You know, like the people who do the police department look at dead bodies.
Oh, yeah.
That's one of the ways that they could tell the difference if it's a child or if it's an adult, is that epiphyseal line. And the absence of that bone indicates that the bone is no longer growing. Okay, so the diaphysis is the main shaft of the bone. And the walls of the diaphysis are mainly made up of compact bone. So what is the difference in the compact bone and the osseous bone? Right. So that means that the shaft of the bone is harder. Okay, it's harder to break. Most often when you get a break, it happens within that epiphysis, somewhere, you know, most often, not always. The center of the long bone is called a medullary canal. It's hollow, and that canal contains blood marrow, and it provides passage for nutrient and arteries and things like that. An endosteum is inside of the diaphysis, and that's just a membrane. It lines the medullary canal, and it contains osteoclasts. Does anybody remember what osteoclasts are? It absorbs, yeah. It reabsorbs, or it's bone reabsorption is what it's responsible for, or what it does, huh?
Then osteoclast forms the bone.
Yeah.
Right. Then the osteoclast will form the bone, and replaces it with new bone. Okay. So all of that happens within the diaphysis. Okay, the structure of the long bone, the shaft part of the long bone. Then you've got the metaphysis. If you look down at page 15, and it spells it out pretty good. That is right above the epiphysis. That's just the flared part of the bone. And it's just the transition between the epiphysis and the diaphysis. And it's mainly made up of cancellous bone, and it functions to support the epiphysis. Okay? That's how the structure of your bone is. Then you've got different types of bones. Long bones are named because their length is greater than their width. Okay. The long bones in the upper extremity are the clavicle here, the humerus, which would be here, your radius and your ulna, your metacarpals and your phalanges. Your metacarpals are here, and your phalanges are here. Okay. In the lower extremity, it's your femur, your fibula, tibia, metatarsals, and phalanges. Okay. And you will need to know that on your practicals. You'll have to show me a long bone. And then you've got short bones. Short bones tend to be more equal, have more equal dimensions in height, length, width, and they're sort of shaped like a cube. The bones of your wrists, your carpals, and your tarsals, wrist bones that are right here, okay, are called carpals. Then you have the exact same bones on your feet, but those are called tarsals. Then you've got irregular bones. Irregular bones just have a mixed variety, mixed shapes. They don't fit into the other categories of the short or the long bone, and we forgot flat bone. We'll move back to it in a minute. The opening, the center of the vertebra that protects the spinal cord are considered irregular bones. So your coccyx and your sacrum, your vertebrae, and your face, and the mandible, the facial bones are considered irregular bones. Okay, and then the flat bones, they have a really broad surface area, but they're not real thick. That's like your scapula is a flat bone. They're made up of two different layers of compact bone, so they're pretty hard. And then they have cancellous bone with some marrow in the middle. Okay, but they're more hard than they are. They have more of the compact bone than they do more than of the trabecula. Okay. The ilium, the scapula, and then there's the cranial bones are good examples of flat bones. Okay, and then you have a sesamoid bone. There's a lot of different sesamoid bones in the body, and they take the shape of a sesame seed. This is why they're called sesamoid bones. They're small bones, and they're usually located where the tendons cross the ends of long bones. Okay, the most common one that we know of is your patella, your knee bone. Okay, the patella is a sesamoid bone because the patella is encased inside of your quadricep tendons. Okay, and just the shape of it, of the sesamoid bones, is what will give mechanical advantage to your quadricep muscles. The fact that that sesamoid bone is inside of those tendons is what gives mechanical advantage to your quadricep muscles. It just allows it to generate more force. Okay. There are no long or short bones in the axial skeleton, and you can write this down or underline it. And there are no irregular bones in the appendicular skeleton. Okay, so when I ask you what an irregular bone is, you're not going to show me the arm because there's no irregular bones in the appendicular skeleton. Okay. Okay, so some common skeletal pathologies that we may see, and depending on where you're working, you would see more of these disorders in like outpatient rehab. You may see some in spinal cord injury rehabilitation centers. So a fracture is one of the common skeletal pathologies. It's a broken bone, cracked bone, the same thing. Okay, someone says, I have a broken bone, not a fracture. Well, they do have a fracture because it's the same thing. A broken bone fracture, same thing. Osteoporosis, that's a condition that's characterized by loss of normal bone density or bone mass. Have you ever seen those? We call them Dallinger's humps, but they have great big humps in the back of their neck here, and they kind of walk hunched over. That is a sure sign of osteoporosis. And when they have osteoporosis, they tend to break bones more often. They tend to get hip fractures more often. Because just the bone is broken down, just that hard layer compact bone is broken down so much that there's just really nothing to. Okay, then we've got osteomyelitis. That's an infection of the bone. It's normally caused by some type of bacteria that gets into the bone. Then you've got the epiphyseal disorder. The epiphysis of a growing bone is not firmly attached to the diaphysis, and this normally happens in kids when their bones are not finished growing. And that can make it slip or become misshapen. And that causes what they call leg calf Perthes disease. Okay. That happens when the blood supply is interrupted to the long bone or to the shaft of to the femoral head, and it causes the bone to decay, to die, causes necrosis of the bone. I've worked with, they weren't my patient, but I actually worked with them. They were coworkers who had this epiphyseal disorder when they were kids. And it did cause a deformity in their leg. And when they walked with a pretty pronounced limp. Of course, they had surgery and stuff like that to replace some of the necrotic bone, but it didn't really cause a lot of issues as far as to her everyday life. She still was able to work and able to do everything else, but it did leave her with a pretty pronounced limp. So let's go back to table 2.3 on page. Oh, well, it's right there. On page 18, you have to know these, okay? I don't know, the best way to do it is to memorize it. But these bone markings, the depressions and the openings, you're going to see a lot in a lot of disorders. And it will make your life 100 times easier if you know these. So a foramen, that is a hole through which blood vessels, nerves, and ligaments pass, okay? And an example of that would be your vertebral foramen, which we will go over, and your cervical vertebrae, okay? So you do need to know these, and if you have to, look up the example, look up the word, and it'll show you examples of it so you can picture it. The fossa is a hollow or a depression. So when we go over the scapula and we talk about the glenoid fossa, you'll know what that is. Okay, it'll just make your life 100 times easier. So, is there any questions on skeleton? That was a very short chapter. Now, if you want, we can move ahead and go over the articular system. If you would like to move ahead, because that's a pretty small chapter too. So we can spend more time on the physics part of it. I mean, if we do, if you want to, that's fine. I just have to go print some stuff out. So let's go over the assignment. Chapter 2 assignment. Sarah, are you still with us? Can you hear everything and everything's good?
Yeah.
All right, so chapter 2, questions. What are the differences between the axial and the appendicular skeleton? The axial skeleton does not contain what type of bone?
Long and short.
Okay, that's one difference. What does the axial skeleton consist of? Okay, and what type of bones is not seen in the appendicular skeleton?
Irregular incessantly. The appendicular move around the axial.
Yes. All right, give me one example of a compact bone. And where would you find it?
Diaphysis.
Of what? Of a long bone, right. Yeah, the short bone, irregular bone, they don't contain a diaphysis. Okay, only long bones have the diaphysis, the epiphysis, and the metaphysis. Okay, and then give me an example of a cancellous bone.
The epiphysis of almond.
Yes. Also, the cancellous bone in other types of bone is found sandwiched in between layers of compact bone. Okay. So which is heavier, compact bone or cancellous bone, and why?
Compact because it doesn't have any holes
Right, because compact bone is heavier because it's less porous. Okay, so number 4, what type of bone is mainly involved in an individual's growth in height? Long bones, right. And where does this growth occur? What part of the bone, what portion of the bone does that growth occur?
Isn't the epiphysis?
Epiphysis, right. Okay, so what is the purpose of a sesamoid bone?
Give the tendon more structure.
More function. Yeah. The patella, the main purpose of the patella itself increases the angle or the pull of the quad muscles. But the main purpose of all sesamoid bones is to protect tendons from excess wear and tear. All right, for number 6. Name the bone markings that can be classified as, A would be depression and openings. So what is classified as a depression or an opening? An opening.
Media sinus.
Yep. Good. Okay, what is classified as projections or processes that fit into joints?
Condo, eminence, faceted.
Good. And then what is classified as projections or processes that attach connective tissue, such as tendons, ligaments, and fascia? Trochanter. Very good. So, questions 7 through 9, you're going to look at the bone markings that I told you you needed to know. 7, bicipital groove. What is that?
Groove.
Groove. What
Or
is
depression.
right? Ditch-like depression. It's like a ditch, sort of like a long depression in the bone. Humeral head.
Projection.
Right. That projection fits into a joint. So it's not just a projection. Okay, the humeral head goes a little further than that. Okay, the acetabulum. Acetabulum is a deep depression. Also the hip joint. Okay, what is the name of the membrane that lines the medullary canal? Endosteum, yes, very good. All right, what's the main shaft of the bone called? Diaphysis, very good. In children, does long bone growth occur at a traction epiphysis or at a pressure epiphysis?
That'd be pressure.
Pressure. Good. Okay, is the humerus part of the axial or the appendicular skeleton?
Appendicular.
Okay, is the clavicle part of the axial or the appendicular skeleton? Good. Okay, and then number 15, is the sternum part of the axial or the appendicular skeleton?
Axial.
Axial. Very good. So your review questions are done. And like I said before, you may or may not see some of these questions on your exam. All right, so I'm going to give out research topics. Okay. All right, Sarah, I want you to do rotator cuff injury.
Okay.
Carter, you do total shoulder replacement. I've not gotten to see one of those surgeries before, but I would love to. I've worked with a person who had a shoulder replacement, and the rehab from that is tough. Hannah, you do carpal tunnel syndrome. Let's see. Wait a minute, let me look back here. Morgan, you do clavicular fractures. Kenzie, you do, let's see here. One with the elbow that is really cool. And a lot of people have it, and I cannot remember the name of it. Let me find it. Oh, here it is. And go ahead and do medial epicondylitis.
Is it in the book?
Yeah, it's on page 175. Under common elbow pathologies. I don't think I'm missing anybody. All right, so we'll go ahead and stop. We won't move forward. I will go ahead and let you guys finish early so you can get started on your research paper. And does anybody need to go over the syllabus again to remember what's included or in your research paper?
I think I'm good.
No, I mean, it's pretty self-explanatory, and I'm always around for questions.
And it has the little tab on it whenever you go to it on ER. At the bottom, it just says research assignment and then breaks it down for you again.
Yes. Yeah, if you look at right here. One internet reference is all, and then no less than three peer-reviewed references. Does everybody know what I mean by peer-reviewed?
We can get those off the database, can't we?
You can get them off the database. You can get them off of the AOTA journals. AJOT, if you, I think Hannah and Mackenzie have AOTA memberships, then they can help you, let you look at their journal. I have got a lot of, there's a whole bunch of OT practices and AJOTs that are in the lab on that bookcase, that those are considered peer-reviewed articles, okay? So no less than 3 peer-reviewed articles have to be included. No, it's actually due before that, and I don't know.
I was trying to figure it out.
Yeah, is it not in the,
It's in between the 4th and I think the 11th, but it doesn't have an actual date on it.
okay, if you,
Oh, it's April 11th.
look on the weekly schedule.
Oh,
It should be due on the 6th. Yeah, the Monday is the 4th, and then on Wednesday would be the 6th, and that is when your research projects are due.
We finished early this semester.
Mhm.
yeah.
Yeah, you'll finish early.
Will the HP is,
Are there more places doing clinicals for the summer this year?
Hmm?
Are there more places doing clinicals for the summer this year?
So far.
I talked to Brandon, he said that his was in Montgomery. He had to go out there every day. It's like,
Montgomery. Oh, he was at Montgomery General Hospital.
yeah.
Yeah,
He
I
said that
think-
he had to drive. He said he drives there again now. That's where he's working.
It was a great place to learn. Okay. I think that's it for this this class for today. So go ahead and get started on your research papers. Don't wait until the end. Don't procrastinate because you all got a lot more projects that are due by the end of the semester. And the sooner you can wipe them out, the better off you are. And tomorrow morning, I don't know, again, I don't know what's going to happen with the weather. Just keep watch. If they do like a delay, like an inclement weather schedule, that'll mean that everything's just moved back by 2 hours. So when you come in, you'll still come into your first class for me. This is just for OTA. I don't know about the your all schedule. But for us, for OTA, if we are on an inclement weather schedule, then you will come in for your first class instead of at 9, you'll come in at 10 or 11. Okay. But most likely, if the weather's really bad, we'll just do virtual because we never know from 1 minute to the next what the weather's going to do here. Okay, Sarah, I hope the kids feel better, and I will see you next Monday.
All right. Thank you.